Hi, my beautiful people, and welcome to another episode of Mindful the Podcast. Now, today we have a special guest, and we're talking about a very, very important topic, a topic that affects a lot of women, a lot of mothers, whether new or mothers who have had children before. And our guest today is going to help us to break down the topic of postpartum depression. Now, today, my guest is Sophia Antoine, and she is a full spectrum doula, a childbirth educator, and a life and relationship coach. Now, welcome, 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 Sophia. How are you?
I'm very well, thank you. And I just want to thank you so much for having me. It is a blessing and an honor to be here.
Now, Sophia, tell me a little about yourself and exactly what do you do? What's a doula?
Well, a doula is a helper. It's a Greek word that comes from, well, it's a word that comes from Greece, and it actually means a slave to women. So back in the day when women were laboring, other women had to take care of them. So that's exactly what I do for the most part. Most of my time is spent in the birth and labor arena. But since I'm a full spectrum doula, I can assist with fertility, conception, of course, labor and birth, but also end of life transitions as well, because that's a very hard thing for a family to undertake. So having someone that's unbiased to come in and kind of make it a smoother transition and handle all the things the family may need assistance with is very beneficial as well.
Ooh, I'm it's the first that I'm hearing about that one.
Yeah.
And that is interesting. Maybe we have to go talk a little bit more about that after.
Next time. So this will be a series. This will be a series.
Yes.
So yes,
Well,
but I'm sorry, go ahead.
today's topic is a very serious but important one.
Mhm.
And postpartum depression. And I went through that, I went through it when I had my son in 2015. And because of that, I know of other mothers, especially new mothers, that have come and expressed their feelings to me. And when you say it's postpartum and that sort of thing, sometimes people don't even understand what that is. They don't know what that is. So can you tell us what is postpartum depression?
I can go over it most definitely, but first I have to say it's different for everyone. There are some key symptoms that you can look out for, but how you experience it would have been different from how I experienced it as opposed to another mother experiencing it. So, first and foremost, it's a great feeling of overwhelm, not being able to care for the baby how the baby should be cared for. Sometimes it's difficulty bonding with the baby. It could be fatigue, just chronic fatigue. And there's a difference between postpartum depression and baby blues, because baby blues is, again, overwhelmed, but it's short lived. It's maybe 2 weeks at the most, where you're just getting home with the baby and you're getting into your new routine and you feel like you can't do this. So that's the simplest way to say it. But postpartum depression persists. It means that you have no interest in the baby whatsoever. And in some very, very slim cases, there's postpartum psychosis. That's where you hear of the mothers actually hurting the baby.
Oh,
And right, so as much as we talk about postpartum depression and everybody gets scared and everybody gets afraid, and it makes them ashamed to say anything, the postpartum psychosis is maybe 5% of all of the cases. So it takes a long time before you get there. But mostly it's, again, having no interest in the baby, having no desire to hold your baby, not wanting to eat, not wanting to feed the baby, anything like that, feeling guilty, feeling hopeless. So it's very much sort of like regular depression, but it is after you've had a child. And it doesn't stop within the first few months. It can go on for maybe the first year of the baby's life.
okay, because I as I said before, I think I had postpartum depression. But when you introduce the baby blues, I was saying, wonder if I had baby blues instead of the postpartum. But then I realized I had those feelings not 1 and 2 weeks after. I had the fatigue and all of that that goes with having a newborn, and you're a
Yeah.
new mother, you don't know how to take care of this child or what you're doing. But those feelings came in, the sadness, the feeling of um I remember I looked at the child and I was like, why are you here? Why are you just changing my whole life? You know, and I figured because um I had a little experience before. I had clients that had postpartum depression, and it was because of that and learning about that through them and with them that I could identify the feeling and kind of go and ask for help, or could go and talk to somebody, or could go and say, in Jamaica we say cry cream, I need a break.
Yes.
You know what I mean? But I get that others might not know what they're having and that sort of thing. So, does it affect, or how can you really know that you're really in postpartum depression if you don't have any like example or any experience with it before? How you know that this is really what you're going through?
Okay, so there's two ways. One, when you're pregnant, make sure you seek out the education so you can have the symptoms in the back of your mind so you can know. That's first. That should be part of every childbirth educator's curriculum because it's so important, even now, as we were discussing before, in these stressful times. It is so stressful now. And I don't care what category of income bracket you're in, things are stressful. So make sure you go see, I'm sorry, make sure you have that in your curriculum first. That's if you're pregnant. If you've already had your baby, what you want to do, seek out a therapist. And not necessarily say you have to go pay somebody, but you can do the online telehealth, and get that, tell them how you're feeling, and then maybe get a referral if you need to see someone in person. Because sometimes you just need to talk about these things. There is such a stigma on mental health right now that it makes people not even want to share the fact that they're having trouble.
Exactly.
Right. We have to normalize it because sometimes an honest, candid conversation will work wonders to be able to express yourself and say, hey, I'm feeling this and I need that. And just to ask for something that you need, people are having trouble doing that. And it shouldn't be that way when we live in a society where we preach community, community, community. The community will come together and help you if you ask for it, but we also have to make it a safe place to ask for it.
Exactly. And I'm glad you said that because I'm here in Jamaica and there's a big stigma, with mental health, and you asking or saying that you want help. I see kind of breaking now, but I know for like mothers, you're expected to be a good mother right out the park, right out the gate. You're expected to know and do everything. And it was good for me because I like to talk. I love to talk. And I remember for me it's like when I felt a certain way, if I went to the supermarket, if I went to the pharmacy, anywhere I went, anybody that would listen, I would just talk about this little child and talk about what I'm going through and that sort of thing. Even now, there's somebody at the pharmacy, the cashier, and as she see me, she's like, Claudine, are you okay now? It gets a little easier because she used to be my sounding board as I go in there. I just talking. And because I was such a talkative person, but I can understand like persons who are there and you know don't have anybody to talk to, don't know how to talk or express the feelings, because especially here in Jamaica, you don't want to tell somebody that you feel like you don't love your child. And being a new mother, you're supposed to love your child.
Right.
You're supposed to have that happy feeling and everything. Oh, you don't know how to.
Um,
And for me, it was, I don't know. I was so happy that I had listening ears, or as I said, I was talkative, so I made people listen to me. And that helped, that totally helped. But I mean, like, how long does it last? Because I had postpartum, I think, for maybe a couple months. By the time the child was 1 year old, I came out of it. But it lasted for almost 1 year old. You know what I mean? But how long after childbirth does postpartum depression last?
that depends on how quickly you seek help and how you lean into the help. Because again, it can last as long as the child is an infant, so up to 2 to 3 years. And it makes you not want to get pregnant again. And if you do, it comes back doubly hard the second time. So the more children you have and the more it's not treated, because you didn't get treatment the first time, it's harder because you're already in that cycle. Because it takes a woman's hormones up to two to 2.5 years to go back to normal after childbirth. So imagine getting pregnant before that 2.5 years is up. So we're in this perpetual cycle again, and you have nobody to listen to you. So again, up to 2 to 2.5 years, that's when your hormones come back if you don't seek help. But if you seek help, you may have to take some medication. It may be suggested. You don't have to. Let me rephrase. But you may want to get back to yourself a little bit more quickly. And prior to having the baby, again, it's great to put in place your postpartum support system. Get a list of people that you can depend on to come in and do things, so you don't have to worry about being superwoman after you've had this baby. Your body has just gone through a traumatic event. It has pushed another human being outside of it. And you expect to get up, go clean the house, go wash the dishes, go wash the car, go run all the errands.
Yes, everything.
Impossible. It is impossible. So give yourself grace. And for the women who've already had their children, if you see somebody on the street and they have a baby, just call out to them and say, "How are you doing? Is there anything you'd like to talk about?" We have to be the community we want to see. So it starts with those of us who are listening. You know, somebody just had a baby, or even if it's somebody you don't know, you don't have to know somebody to be compassionate towards them.
That's good. And I wanted to ask you, how, if we don't have, like, because if we don't have that support system, or maybe that counseling system, how can we within ourselves, or we how can I, if I realize that I'm having these feelings, how can I just help to get rid of them? Or, because why I asked that question, in Jamaica we don't really have the access then to counseling and the support. There's a lot of single mothers out there, that sort of thing, that really don't have anybody around them. You know what I mean? So if I realize that I'm feeling this way, how can I help myself, if anything?
Okay. Journaling. Get some pens and paper. It don't have to be no beautiful notebook or anything like that. Get a pen, pencil, crayon, whatever it is, and a piece of paper, and write it down. Write it down. Get it all out. Don't worry about spelling. Don't worry about punctuation. Don't worry about nothing. Just get whatever you're feeling out and onto a piece of paper. Now, if you don't want nobody to read it, burn it, throw it away, rip it up, do whatever. But make sure you get it out. It's the act of getting it out of your head and your heart that will make you feel better. Personally, in my practice, I do free postpartum sessions. If you don't have anyone else to talk to for whatever reason, I have free postpartum sessions. I'll give you 30 minutes of my time every day, just to make sure. I'll check in on you, text you, just to make sure you're okay. Because it's too serious to let this go any further, because it can impact yourself, it can impact the child, it can impact the rest of your family. There's no telling how it can devolve into something that's detrimental if you don't get these feelings out.
And I like that. So write it if you have to.
Mhm.
And as I said, find a listening ear. Talk to anybody that will listen.
Absolutely.
That was my strategy. Anybody that would listen to me vent about this child, I would just talk. I
But
just talk and say, okay, bye.
that's what I'm saying. But
Oh no.
people on the street are more compassionate than you think. If you just walk in
They
and
are.
maybe you go to a park or something, somebody says, "Hey, can I talk to you for a minute? This is what I'm feeling." And if they're willing to listen, talk to them. They will talk back to you and then say, "Thank you so much. I hope you have a great day. If you ever need me, I'll hopefully we meet at the park again." So that's how people help each other.
I like that. I like that. Just talk, get it out.
Mhm.
But Sophia, does postpartum only affect like women? Does it affect like the partner or men too?
Absolutely, it does because your life isn't the only one that changed. If you have a partner, their life has changed too. The postpartum depression affects dads very much because now they have this whole person that they have to be responsible for as well. They have to provide for. They have to make sure they get clothes and pampers and milk and different food when they grow up and shoes and all those things. So it's good to be able to talk to each other about it because this is a whole new world you stepped into. And unfortunately, there's no way you can't get this feeling or get this insight by babysitting somebody's kid because you can give it back. At the end of
Exactly.
the evening, this person is coming to pick up their child, or you're going to go drop off their child. But this one, not going away. This one is staying
That's
right
true.
here, right here. No matter how you do, you can't run away from this one. Even if you
That's
give it
so
away,
true.
somebody's going to bring it back because they. So yes, it affects partners as well.
And I think that is what hit me when I had my son. I was always up and about, everywhere, gone all over. And it's like one day I just sat down and I'm like, I have to sit here with you. I can't go anywhere. I have to carry you. I have to just be here. And I'm like, I can't give you to anybody. Like, I'm gonna go and I'm come back and you're here. And when that hit me, I cried and cried and cried. It's just
Mhm.
this week we were having a conversation at work with some men also. We're talking about the postpartum depression,
Yeah.
and um they kind of understood a little, but they're like, yeah, but you have that instinct as a woman. You're a woman. So, why you have to feel that way? And they couldn't understand. So they couldn't understand why we feel that way. And I had to
Mhm.
be saying to them, it's a little bit different for men because sometimes men, that like a happy-go-lucky type of thing, or as they said, you're a woman. So it's like the role definition. So, you know, they couldn't understand that they had a total different view. Like if the child cry, make the child just cry. And they didn't understand that sometimes a child is crying and yes, him can cry. Yes, you can leave him to cry. But you as a mother, the first thing you're gonna look to see if something is wrong. We can't just say, oh, let's just ignore the child.
Right.
You know what I mean? So it was that was a very interesting. So I was like, I'm gonna ask if fathers are affected also
Yeah.
by this postpartum depression. But
But then,
as we talk about that bonding, how
mm,
does postpartum depression affect the bonding with the child? Because I know at that moment or some moments you might not feel like you want or you like the child, or you might have a little bit resentment, but
mm,
afterwards you might pick up, does that bonding, does that child get the same bonding during and after like a mother that does not go through postpartum?
it doesn't because children respond to touch. Babies respond to touch. So, because remember, they've been encased in a womb for 9 months or so, and they're used to being cuddled, they're used to being warm, and now all of a sudden they're made to lay in a bed and not have that touch. So, what happens as soon as a baby is born, Most hospitals put a hat on them, but I try to have my clients forego the hat because the the hormones or the pheromones that's coming off of the baby's head, it affects the chemicals in a mother's brain, and that is what caused the bonding. So
Oh,
hopefully they get that at first, and that is what starts to trigger the different things. Postpartum depression usually happens once you get home and you don't have anybody to take the baby. So now, if you get help soon enough, because this is all on time constraint, you can try to rectify the issue, get some support, and you can resume the bonding process if not too much time has gone by. But if now this baby has someone else caring for it all the time, say for 6 months, 6 to 8 months, they're connected to this other person, and it will take probably that much amount of time for them to get used to you. So you've lost that period of time. Not to say you can't bond with your child thereafter, but it will take time and it will be different. So that's why time is of the essence when it comes to recognizing the symptoms and getting assistance.
and when you said that support and getting help at home is most important. I remember while I was pregnant and I did Lamar's class, and the two nurses that was hosting the class, and they said the most important part after we went through everything, trying to, they went through everything when it comes to a baby. And the last session, they said the most important thing when you have a baby is home help.
Yeah.
And I laughed. To tell you the truth, I'm like, what are you talking about? And I laugh and I joke it up with them. And I'm like, really and truly, who want a family member with you? I mean, don't want no family with me and nobody bothering me.
Yeah.
And you understand? And I'm like, I laughed and I'm like, and they were like, home help is the most important thing. And
Absolutely.
I totally agree now, because
Yeah.
when you come home, when you come home and look into somebody to assist,
Mm-hmm.
oh, that's the greatest thing. Home
Yeah.
help.
Yeah.
Even if it's somebody to come once in the day, once a week, so that you can just relax and rest, is the greatest thing ever.
Absolutely. And even for my clients, we do a birth plan, we do a pain management plan, and we do a postpartum plan. So all of this is in order before you have this baby. So nobody's missing a beat. I send out schedules to who they give me the people email address. I send out schedules. You're coming on this day. You're coming on this day. Or you're coming noon. You're coming night. And just to come wash up the dishes, sweep out the house, just make sure you care food. Just to make sure you bring in the trash can from the curb. Just little things that you do on a daily basis that it can throw off the rhythm of the house if they don't get done. So I go through their home and I look for all of those things, make a list, and I assign it. I assign chores to different family members, different people. That way, this mother can take care of her health because that's what's necessary at this point in time.
I love that, Sophia. I love that. And it's the first I'm hearing about that, a postpartum plan. Yes. I did
Yes,
Lamar's class and I did not hear about a postpartum plan. I mean, they mentioned that home help is important, but we didn't have a plan. And
right.
I just love that you can make a postpartum plan and just, have your support on hand and everybody know what they're supposed to do and can do. I just love that. So now I know.
Yes, absolutely. Because you know what? Everybody want to come to your house and look on the baby and hold the baby and do all this.
Exactly.
So pick up a broom while you're here. Before you leave, sweep out the house. Just don't just come to just look and see and then don't do nothing. That's not helpful. So I'm going to put you to work while you come. Yes, you can see the baby, but understand there's a price of admission.
I
That's it.
love that. I love that. Put people to work, put everybody to work and
Everybody can do
assist and
something.
help, because it really does. It
Mm.
really does. And I remember while home, I was on maternity leave and home with the baby. And as I tell you, my first child, I don't know. I mean, when I came from the hospital, me and my husband look at each other. We're like, okay, what we must do with him? We looked at each other, we looked blankly, and we're like, what we must do with him? And my husband's like, I don't know. So Mr. Me don't know either.
because
And
everybody
I mean, days
different
after
experience.
that, just for somebody to stop by and bring me food, I felt so good.
Yes.
Just to talk to the person, just seeing another face in the house is not just because in the days he went to work and I was home with the baby and it was just me and the baby. And it was a joy when it was just one person that would come and I could just see somebody else. And I had to strategize as you say, you have to talk it out and stuff. And I had to strategize and I had to take that baby and go for walks.
Yes.
And I remember just walking on the avenue and the little kids, because it was like summertime and the little kids were home and me and them turned friends. We were all friends, me and the kids, because I just stopped. I would just watch them, talk to them, and that was I couldn't wait until that time to go for a walk just so I could see
Mhm.
somebody else,
Yeah.
you know?
You would go crazy in that house just looking at the baby looking at you, and you know he wants something because he can't do for himself. So you have to change him, you have to feed him, you have to bathe him, you have to burp him, all these things. And it's so monotonous. Day in and day out, the same thing. You need some other type of stimulation. There's only so much the TV can do, the radio can do, the phone can do. You have to have interaction with other people.
Yes, and I had that feeling of just, this is all I'm here for,
Mhm.
this feeling of this worthlessness. And I'm like,
Right.
this is what having a baby is about. This is what I'm here for, to just wait on him hand and foot. But
Yes.
Sophia, I felt a little selfish after a while, and I'm like, wonder if I'm being selfish, wanting time for myself, it. After a while, I was like, am I selfish? Is something wrong with me? Because I feel like I want to do something by myself. I want to leave the child. I don't want to really see him for a half an hour. Is something wrong?
Absolutely not. You are a whole person with a whole life prior to this person coming into the world. And you can't be expected not to have your same emotional needs afterwards. It is absolutely okay. Nobody can do anything for long periods of time and not have the desire to stop or not have the desire to do something different. It's not selfish at all because that's how you recharge yourself. That's how you come back to yourself. It's time alone, time doing something that you love to know that this isn't all to you. You had likes, you had hobbies, you had things you were interested in prior to having this baby. And to expect you to just come to a full stop afterwards is unrealistic. You're doing a disservice to your child and your entire family by just doing that, by just stopping, because that's what makes you you. That is what fulfills you. That is what you're passionate about. And if you aren't comprised of your passions and your likes and the things that make you happy, what type of person would you be? You won't be happy. The happiness comes from indulging in the things that replenish you, that recharge you, and coming back and being your best self with the people that you have to interact with day in and day out.
I love that. Because I felt like I was just totally enthralled in this child. And it's like I was losing myself. I couldn't do anything. I could barely bathe
You
or
see?
even eat because you're tending to this child. And I was like, I'm losing myself. This
Right.
is just not me and not what I'm made up for.
Correct. And you don't want that.
No. So
No.
Sophie, can you give us an example or like give us a little of an experience of somebody that really, really went through postpartum and
I
how they overcame that?
I can tell you for myself because first I had my first child when I was 15. So I still had to go to school. I still had to go to work and I had to take care of him. Thank God my mother was there, but she said, "You had this child, you're going to take care of it." So that's what I did. So I didn't know. And of course, Jamaican mother, Jamaican father. What do you mean? So you don't feel like holding the baby? I don't feel like holding the baby. So one night, it just got to the point where I had school that day, I had work that evening, came in, and I was feeding him. I got to the point where I said, you know what? I can't do this. Can't do it. So it's either I leave him here on the bed by himself and run out of the house, or I go give him to her and I take time for myself. So I politely pick up myself, go out of my room, go knock on her bedroom door. She said, come in. I handed him to her, not even one word. I walked out of her room and I walked out of the house. I had to get time because it's a lot. So imagine an adult who has all of their faculties, and me that was only by that time I was 16. So by that time I couldn't handle that. That wasn't for me. And imagine I couldn't go to no more parties. I couldn't go to no more school dance. I couldn't go hang out at the park. I couldn't go do all my life stop a screeching halt. Like say a car getting in an accident, try to avoid accident, screeching halt. So eventually my school was set up where the bus came and picked me up. We dropped the baby off at daycare, and then I went to school. And I was so blessed that the lady that was over the daycare, she recognized it. And she is a good reason why I got into this work too, because she helped me work through it. She talked to me every morning, every evening, where, asking how I'm feeling, how am I doing, what if I need help or anything like that. And she advised me where I started journaling. That's why it's the first thing that comes out of my mouth for any situation. Write it down.
Write it down.
Because it's better out than in. Because when you're stuffing it down, something else is gonna happen and you put that on top of it. Something else, put that on top until you explode.
Yes.
Then who's to say what will happen when you explode? Where will you be? God forbid it be the child that you explode on. That's where we get into the postpartum psychosis because you stuff it down so hard, so fast, so much because you have to be this thing for the world that nobody's really expecting of you. You're putting those expectations on yourself. So when you just slow down and think about it, just get it out. That's your first line
Just
of
get it out.
that's it. If all you can do is repeat the words, just get it out. That will be so helpful. So that's what I did. I had notebooks, mostly 20 notebooks by the time the year was finished because I had to write it down because my life had changed so drastically. And then by the time I had my last child as an adult, I had a better hold on it because I have a total of three. I had a better hold on it. And not to mention with my first one, since I was so young, I experienced obstetric violence. And that only dawned on me when I became a doula because nobody asked me for consent for what they can do. So that's another piece of the postpartum depression where it came in at because doctors and nurses have a way of talking to you like, say, them a God.
Yes.
Like they know everything. Like, say,
Everything.
I didn't have this body before I meet you. So of course I know what's going on with it, but because you went to somebody's school now, you feel you know better than me. But that's not true. If I tell you, say, my leg is paining me, you can't tell me it's because I licked my head. You can't say that. I'm
True.
paining it because I hit my toe somewhere. But doctors have a way, and sometimes the nurses have a way of saying, well, you have to do this, and you have to do this, and you must do this. No, you ask me and you inform me, informed consent. You tell me why this is beneficial, and you allow me to ask questions about what's going on or if this is the best route for me. Because all patients are different. We may present with the same ailment, but all patients are different.
Yes.
And they're understanding. Make sure I understand what it is that you're saying before you proceed with this type of treatment. Don't just come grab up my arm and give me an injection. Tell me what's in this. Will I have any side effects? And how long will the side effects last? And make sure I'm comfortable with it before proceeding, because that shows respect for me as a patient. So all of these pieces have to come together in order for you to be comfortable being a patient or being that you had a good experience, a good healthcare experience, no matter what it is, but pregnancy or not. But in this case, we're talking about the postpartum depression. Don't just tell me what's going on with me. Ask me what I'm feeling.
Feeling.
my feelings.
And I think that's the key. That's the key, Sophia. Ask me how I'm feeling. And I find that healthcare professionals, you go to the hospital when you have the baby, everybody's around the baby, everybody's about the baby, you know,
And you see kids,
and what you can do for the baby. And nobody asks you, how do you feel?
yes,
Nobody asked you. And I experienced that also. I was in the hospital for a couple of days after. And I remember a nurse came in the room and she was like, from morning you here, you don't bathe the child, you don't do this, you don't do that. And I'm like, because I don't know what to do really. I'm on I'm waiting on my aunt to come to bathe him and all of them. Because I'm like, I don't know what really to do. You know what I mean? So I'm here just trying to make him not cry and trying to bond a little. And she came and that was it. Like I was the most worthless
see,
mother ever. And I'm like, nobody asked me. When she finished, I sat there and I cried. And I'm like, oh my gosh. And nobody asked. She didn't ask me, how do you feel? Are you
right,
having any challenges? She didn't.
exactly. And sometimes that's all you need to feel better. You don't have to come rough me up. Just come say, well, I see that the baby hasn't had a bath yet. Did you need help with this? There's a way to say things that will make people feel worthy instead of worthless.
True,
So,
true.
yeah, so there's a way to handle people. And I just think that sometimes when healthcare professionals have been in their positions for a long period of time, they just get so into a routine that they don't really consider that you're dealing with a different person. It gets to where like they don't see faces anymore. You
Yes,
know you have a job to do. And not to bash them, I know they have hard jobs. I understand. But you have to remember the people piece of it because most healthcare professionals I know, they got in the business to help.
to help. That's it.
So you can't
That
be a
is it.
hindrance at the same time.
And while talking, Sophia, one thing that went in my head was the hormonal or the is it that we women like when we have a child, is there something going on like in our brain and our bodies that let us get this? Is it like people of a certain age that we get depressed? What is it something neurological, something in the body that brings on this depression?
It doesn't discriminate. It's just a change. It's a drastic change. Just think of any other change in your life. Say, um, if someone got in a car accident, now they can no longer walk. That's they're going to go into depression because you used to getting up and going whenever you want. So now, same thing. Now you have a baby. You can't get up and go. There's no touching road like you used to touch road before. You have to plan months and months in advance. Say, okay, I have a babysitter, I have the food, I have my clothes, I have this, and I have that. Now I can go touch road. But before that, no, sir. No, you can't do it. It's not the same. So it's just the shift in life that has come on. And that's why I say it's best to plan for it while you're, before you even get pregnant, have a plan. Know that these things could happen, and it still could. So, all the planning in the world will not prevent postpartum depression. But what it will do is lessen the time that you have to spend there because you know better.
Yes, because now I think I would have understood it a little bit more and planned for it. You know what I mean? So you have to go through it. But we talked a little about
Mm.
talking it out, writing it out, just expressing yourself. But what are some of the other coping strategies or treatments that somebody with experiencing postpartum depression, you know, um, can do or receive?
So, there's mindfulness. Just sit. Breathing can take you a long way because fear makes you stop breathing. You either take short, shallow breaths or you hold your breath all together until the feeling has passed. So, what you can do is make a conscious decision to breathe, stop and slow down, and just get through the next moment. That's it. That's all that's required of you. Safely get through the next moment. So that's a big one. And unfortunately, another one is depending on somebody else. Calling, have somebody take the baby if you possibly can, but go for a walk just by yourself. All of this circles back to what we discussed before is me time.
Me time.
You need it. You are a whole person and you have to nurture the person you are, the person you were before this baby came, in order to get through this safely.
Wonderful. And how can family and friends, I mean, we touched on it already. How can they truly support someone who is experiencing postpartum depression?
First, ask the person, the mother, how she is doing. Don't forget that she's there just because a new baby is here, because the baby wouldn't be here without her. Somebody come in, one person take the baby for a little while so she can wash up herself and do whatever she needs to do for herself. Feel like a human being, not just somebody who's there to take care of the baby. Clean up the house, carry some food, go do the grocery shopping. And you don't even have to ask. And I despise somebody asking me, what can I do for you? Because you walked into my house and you see. Better yet, you have your own house. What would you do if you were at
You
home?
do.
Exactly. Don't ask me no silly questions. You know what needs to be done in the house. It's not the first time you come to my house. You know what to do. Even if you don't do it perfectly, it's done. I'm not asking for perfection. I'm just asking, say, you wipe down the bathroom for me. Maybe wash up the dishes in the sink. Make sure if the baby's bottle fed, make sure the bottles have been sterilized. Make sure there's some in the fridge already with milk, so I just have to heat it up. Just those little things that make life easier for a mother that just came home from the hospital, they work wonders for her self-esteem. And don't come asking. You'll gather amongst yourselves, since when I check me anyway, go ahead, gather amongst yourselves, come up with a plan, and just come in and do it. Say, Sophia, this is the day I'm going to come. I'm going to love on you, and we're going to take care of the house for you. We'll come back in, maybe a day or two and come do it again. Or one set of friends come one day, the next set of friends come the next day. So many hands make light work. That's it.
Great, great, great. I love this. And I loved our chat. I loved our chat. I'm learning so much. And I know my listeners have learned so much because as I said, this discussion, I just had it last week with some coworkers, you know what I mean? And it was so interesting. So I'm so grateful, Sophia, that you could come on and you could just educate us on postpartum depression and what it is and how you really feel, how people must feel, and how do you get over this. So I mean, I like to do a little recap, you
Yeah.
know. So I just want to say to mothers, I know because I was one of them that was on this perfectionism. I don't know what to do, but I was like, I have to do everything and be perfect. Debunk that. And you have to also realize that if you feel that that feeling, if you feel like you can't do this, if you're feeling the feelings of worthlessness, like you don't like the child or whatever, talk to somebody, right? That's what we say in Sophia. Talk to somebody, express yourself. Anybody. As I said, I went on the road anywhere I could have a listening ear. I was just talking.
Mhm.
I didn't have to know you. I was just talking about this child. So talk about it. Express yourself. You don't have to feel any shame about it. Just express yourself. Ask for help. If there's no one there, if you can't express yourself, journal, write it down. You just take a little paper and a pencil or a pen, write out your feelings. Write out your feelings at all. And then support system. If you can gather a support system, you know, if you can find support, whether it's community, family members, friends, get that support system and get a postpartum plan if you can. I was hearing that for the first time, and that's brilliant. I think that's a brilliant idea. And if I knew of that then 9 years ago, I would have had and put in place a postpartum plan. So all, try if you can have or put in a postpartum plan, have that. Who must come and do what? Who must do this? Have your plan so that, and the most important thing is slow down and try to have some me time. So that's what I have gathered and learned, from our talk today, Sophia. But in wrapping up a little bit, what advice or words of encouragement would you give to not just new mothers but mothers generally?
There's no perfect parent. Just like your parents before you, they did their best. You're doing your best. Nobody sets out to um, deprive their child of anything. So trust that you are doing well and you're teaching your children as much as you have, and seek out help. May it be somebody from their school, may it be somebody in the community that knows something they want to learn. Just get them the resources. You don't have to do everything. You don't have to be superwoman, because you're doing the best you can. And your best is all that's needed. Because at the end of the day, children just want to be loved and cared for, nurtured, and fed. But most definitely, they just want to know you're there. So I am so proud of each and every one of you who want to do more, but trust and believe you're doing more than enough right now.
Great, great, great. I love that. So thank you so much, Sophia, for coming on and, just educating us on postpartum depression and what we can do. And we have learned a whole lot what the mothers can do and what others can do, to help persons who are going through this. And this is not something that it's postpartum depression is not something that we must feel ashamed about. I know there's a lot of stigma, as we said, about mental health. You don't have to feel ashamed about it, but talk to someone, let it out and get it out. And people, ask mothers, how do they feel?
Yes,
So thank you again, Sophia, for coming on and, just imparting your knowledge to us.
my pleasure.
Thank you so much.
Thank you.